Welcome to the Global Health Matters podcast. I'm your host, Gary Aslanian. In this episode, we will unpack migration's influence and impact on health. Migration is a journey that is filled with great hope and extreme peril for many. The WHO World Report on Health of Refugees and Migrants estimates that there are some 1 billion migrants globally. The report highlights migration and displacement as key influential determinants of health and well-being and urges for collective action to ensure that health is a reality for all refugees and migrants. In this episode, I am joined in conversation with Reem Moussa. She is the humanitarian advisor and coordinator of the Forced Migration Team at Médecins Sans Frontières, based in Brussels. Reem brings a wealth of operational experience and deep policy insight to today's discussion. Later in the episode, you will also hear from Eugen Ghița from Roma Lawyers Association, called Roma Just in Romania. So stay tuned. First, I'm joined in conversation by Reem Moussa. Hi, Reem. How are you today?
Good. How are you, Gary?
Great. Thanks for joining me today. So I'd like to dive right into the deep end, and maybe we could start by you sketching a picture for our listeners of the complex social dynamics of migration, especially as it relates to health.
As you can imagine, migration is an extremely complicated and diverse topic. There's many different types of migrants in the world, and obviously, as a humanitarian organization, MSF often focuses on the most vulnerable migrants in the world, which are those that are forced migrants. However, from a migration and health perspective, we know that migration can be both a positive and negative indicator in terms of health outcomes for people. Many people migrate for various different reasons globally. You have student migrants, working migrants, but however, we know that their health outcomes are relatively similar to host populations, even if they might face some initial challenges in terms of their integration into the health system. However, we know that there's a portion of migrants globally, particularly those that are forced migrants or undocumented migrants or labor migrants, particularly from the global south, that often are exposed to various poor health outcomes linked to the migration journey itself, but also linked to the policies and health systems in countries in which they arrive and they migrate to. And increasingly, that health landscape is becoming a more restrictive one, which means that migrants' health outcomes are defined by that restrictive political environment in which they arrive for various reasons. We saw that during COVID specifically, that migration was a particularly important phenomenon. And I think we saw both the ways in which in many places, migrants play a key role in the health workforce as well. But we also saw the ways in which mobility was restricted as part of the global pandemic. And then that had a ripple effect on migrants that were on the move in terms of their access to healthcare. So whether it's migrants that are on the move because they're fleeing conflict or other issues at home, or those that arrive, labor migrants, we saw that in many ways migration was a key factor into people's health and many times linked to the social dynamics and the social context in which people move.
Reem, as you explained, refugees and migrants sure face a myriad of challenges when it comes to ensuring their own health during their migration journey. For this episode, I had a conversation with Eugen Ghița. Eugen is a human rights monitor and president of the Roma Lawyers Association, called Roma Just. However, at one time in his life, Eugen was a migrant himself. Let's listen to Eugen's migrant experience when he arrived in Greece.
So, like any refugee, when I arrive in a host country like Greece, the first impact is that I didn't have the legal residency document, which means that I didn't have access to any kind of public services, also to the health. I had to wait for 2.5 years to get my identity and residency documents, and only after I was able to benefit from proper medical services. The first 2 years, health was equivalent to having money. It was not easy. money means health for me. For this reason, I was very difficult to stay healthy in the first 6 months because there was no program for us as economic refugees. I couldn't access the health system at all due to language barrier because I only spoke Romanian and Romani, like Roma, Romanes. There was also a lack of information because we didn't really know if there were free programs for us. There was a lack of information dedicated to refugees.
Rim, what are your reflections on what Eugen just shared here? And are there any other common health system challenges that migrants experience?
I think Eugen's experiences are very telling and accurate of the experience of many migrants on the move today, particularly arriving into the European context, but not only. We see a similar pattern across many environments, whether it's in places like South Africa, Australia, the US, Mexico. So there really is a pattern today of migrants finding it quite difficult upon arrival. Particularly those that, as I mentioned before, are forced migrants or people arriving in countries irregularly or on alternative migration routes. And these are in two folds. One, you have a set of policies, often linked to restrictive migration policies, which result in things like detention or containment that in themselves have adverse health impacts on people's well-being. For example, MSF's operations on the Greek island in Lesbos and Samos, we found that there's a disproportionate amount of mental health needs that are found within the population. We know that oftentimes people in these contexts, their health often deteriorates. Sometimes they arrive quite healthy, but due to poor or limited access to health, but also the conditions in which they're contained. Oftentimes, they start to develop health conditions, sometimes minor ones like respiratory conditions, but or recurring conditions like this, but also sometimes chronic conditions that could be quite manageable become quite complex and could have long-lasting health impacts for people and their well-being. And as I mentioned, the mental health burden is quite significant, and we often see the impact of that on people and their well-being. So you have these sets of restrictive migration policies, as I mentioned, that can result in adverse health outcomes in and of themselves. But then you also have limitations in terms of the access to healthcare. And there is, many countries that do allow for people, regardless of their legal status, to access healthcare. And of course, that's from our perspective, universal healthcare is something that's very important and is something that every person should have a right to. However, there is often sets of administrative barriers that mean that people only have access oftentimes to emergency healthcare. So until someone gets very, very sick, they're kind of on their own, right? Unless they have money. But it's not just the paying the fees into the healthcare system that's the problem. Oftentimes, migrants, particularly those without legal status, or with precarious legal status are afraid to even seek healthcare because they might fear the potential risks of deportation or having to interact with the authorities and the official system because of this restrictive environment that we work in. So that's why it's very important that there remains to be a separation between border control and migration services and health services. And this is what we call firewalls. And, it's very important that there is firewalls between health systems and migration control to make sure that people feel safe in terms of accessing healthcare when they need to. And that's something that is not always the case. And then, of course, as Eugen mentioned, for many migrants that are able then to actually access the system, they often find barriers in terms of lack of cultural understanding, cultural competencies, but other forms of discrimination and xenophobia in the system, which oftentimes is more invisible, but is definitely something that people feel and has ripple effects and ability for people to seek care and improve their health.
Later, we will hear more from Eugen as he shares about refugee situation in Romania. So stay tuned for that. Rim, I'd like to ask you next about the myth about migration and healthcare. Could you help our listeners distinguish between reality and the myth around it?
So I think some of the most common myths that we have is that migrants are a burden on healthcare systems, or that migrants are coming potentially to maybe more well-off countries to take advantage of their social welfare systems and their health system. However, this has been found to be a myth in a myriad of ways. One, that we know that in total, statistically, migration actually is a net positive to countries globally, and that's accounting for all the different types of migrations that we speak about before. We know that in many countries, migrants and people that are born outside of those countries make up a big chunk of the health workforce in many of these places. And as I mentioned COVID earlier before, we saw that the role of both documented and undocumented migrant laborers in our health workforce, but in other services that complement when it comes to cleaners, cooks, security staff, all the people that make the system work, oftentimes come from diverse backgrounds and are net positive to the system. So this has been shown time and time again by studies that migrants are a net positive generally to economy of countries, but particularly to the healthcare system specifically. However, as I mentioned, there is a unique challenges that migrants face into the system, and oftentimes it is the most vulnerable migrants that face those challenges. And they often are a very small percentage of the migration population. If we actually had a more inclusive health system, so for example, if we actually allowed people to have access to primary healthcare, and countries that do allow people to have access to primary healthcare, that often results in less pressure on the health system in terms of supporting that population. Otherwise, if you exclude people from the healthcare system, you're only going to see them when they end up in the emergency room. And that becomes a challenge. So actually, by providing holistic care, by providing universal health care, not only are you able to provide better health care for the individual people, but in terms of from a health system perspective, as a system as a whole, it's very manageable actually to provide a good quality of care, and through actually excluding people and providing preventative care rather than waiting for migrants to get very, 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 very sick. So from both sides, I think the myth is actually harmful and actually creates and reproduces pressure on the healthcare system that is unnecessary.
Which is true for anybody, they're migrants or not. Obviously, prevention alleviates the pressure on the health system in terms of more complicated and tertiary care.
That's also why I think the WHO's position, but I think all of our positions as people that work in the health space, is actually universal healthcare, because we actually know that not only is that important for individual people, but it actually is better for health systems as well.
Exactly. Rim, countries have adopted a variety of ways to deal with asylum seekers and refugees. One approach has been offshore processing. I read in one of the reports published by MSF and Médecins Sans Frontières that mental health conditions are very prevalent among people who are being held in these offshore processing centers. One such country is the country of Nauru, which is an island, and it also functions as one of Australia's offshore processing centers. The MSF report indicated that 2/3 of asylum seekers on Nauru experienced moderate or severe depression, which led to high levels of attempted suicide. This is a very astounding number to me. Could you tell our listeners more about the health impact of migratory policies?
Migration policies have a direct impact on health. And unfortunately, today, what we see in the political landscape is that there's less policies that are providing protective factors and an increase of what we call restrictive migration policies. The example in Australia that you mentioned in Nauru is probably one of the most harsh examples of offshore processing, which is an indefinite policy that moves people who arrive in Australia by boat to islands like Nauru and Papua New Guinea for offshore processing. Many of those people are identified as refugees and asylum seekers, but there is no plans to relocate them to Australia. So they are kind of stuck in this limbo. And many of the people that we treated in Nauru were people that were already there for 5 years when we were there in 2018. And some of them remain today. So the pressure of these policies, as the report shows, but what we see also in other contexts, is that there is a devastating impact to people's mental health. They're put in a situation where there's no way back, there's no way forward, and they're trapped. This is often after taking very complex and dangerous journeys. and being exposed to various violence in these journeys. We also know that family separation is one of also the key indicators along these migration routes that lead to a lot of the mental health suffering.
Mm-hmm.
Sadly, however, we see a replication of these policies and this policy logic in other countries, some in different ways. You may have heard that the UK government now wants to introduce a similar model inspired by the Australian model to offshore process people in Rwanda. And similarly to Australia, this policy will mean that people will be transferred to Rwanda. And even if they're recognized as refugees or asylum seekers through that process, they will not be returned to the UK. And history has shown us that these policies cause a disproportionate amount of stress. They don't properly identify vulnerability. And oftentimes, what that means is that people fall into a very, very deep depression and PTSD, or also what we talk about as a continuous trauma, where we know that the daily stresses of being in these situations compound any previous traumas that they've experienced before. And we've seen that also in, for example, the hotspots in Greece, where we know that people remained there for many years. And we saw very similar outcomes where many of the patients that we treat in our projects in Lesbos and Samos were also identifying with being diagnosed with conditions such as PTSD and other traumas and anxiety. But we were also seeing in very, very young children, but also in general population or group, a high level of suicide. So in 2 years, we had about 180 patients attempted suicide or self-harm during that period. So, these policies that are being replicated in different ways in different countries have the same pattern in terms of the outcome. And that outcome is a deterioration of mental health and well-being. We also know that as these policies become more restrictive, we also see an increase of border securitization and policing at borders. And oftentimes that comes with a lot of violence by authorities. And so we are often treating trauma and injuries of people that are confronted by authorities at borders and directly beaten and bruised. And we know that these things interplay with one another on migration routes and are really causing a deterioration of a population that could have generally okay health. But what these policies are doing is actually leading to someone that could arrive relatively healthy becoming very, very unhealthy as a result of these policies.
Maybe we can concentrate on migration policies in Europe, which draws populations from across the world. In my conversation with Eugen, he was also able to share a bit more about the current situation regarding Roma refugees coming from Ukraine. Let's hear from him.
From 24 February, in Romania came nearly 30,000 Roma refugees. They didn't had the properly ID documents because they left very quickly from Ukraine. They didn't have the time to go back in the houses. Maybe was a story. One family with about 15 members. They run with anything from the house because their house was bombing, and they didn't have any paper document. And came in Romania, they started from zero. And for that, you cannot access to the health system because you don't have identity. And others problem with a passport, and they have another passport, so that from the Ukraine, and was not really good from European Union. And also that was a little bit obstacle for them to go with that because they didn't have in English anything, was in Ukrainian. And the biometric have also a little bit English translated and to understand doctor, police, who's your name, family name, where you born, how the year and everything. And for that was a little bit taking time to translate the document, and after that to go to the health system. So it was the second obstacle for them. It's a big obstacle because the Romanians that didn't ensure it in all the centers where they came from Ukraine to have translators. The system didn't be prepared to get them, to receive so many refugees. is not so good from my opinion. So Romanian state have to work a little bit more how to receive them in the health system, national health system.
Eugen touched on quite a few issues here. Some are acute because of the current war in Ukraine, but others are of more of a long-standing nature. What are your reflections on these challenges that receiving countries have and experiencing?
I think the war of Ukraine is a very interesting example because it shows potentially how countries can respond if there's a political will to respond. And I think that that was a very big component. Of course, receiving a large influx of people to your country is always a challenge, even if you as a country are willing and able to host them. And I think Eugen touches on this, that even though people were able to come across the border into countries like Romania, but also Poland, Hungary, Moldova, and Slovakia, and as well move on to other countries, that still the health systems in those countries have to adapt to that large influx, which takes time and is a challenge. The very key element of this, which is different to other refugees and migrants and asylum seekers coming to Europe, is that for people that arrived from Ukraine, they were able to apply for a temporary protection directive, which also allowed them to have access to the healthcare system in the countries in which they arrive. And that's very key. It already facilitates the entry point into the healthcare system. However, that doesn't mean that then the healthcare system is equipped to absorb very quickly this new cohort of patients. And there is still ongoing efforts, and there was quite a few to adapt to this. I think that there were some initial shocks described by Eugen. That comes to cultural mediation, so translation within the healthcare system, also understanding of the different health profile of people coming from Ukraine. Even though it's just right across the border, there is specific health challenges that might be present in Ukraine that might not be present in to the same extent in some of the host countries, like TB rates and things like this. And then there's also the population that was arriving, which were predominantly women, children, and elderly people. And so also the specific health challenges that that population has, and then also the health workforce. So that's in terms of the very willingness. And of course, reinforcing a response to the health needs of refugees, so including the mental health component to that, right? So I think that there's been a big deployment of efforts in that. There is still some gaps, particularly when it comes to continuity of care for people arriving, and there is several challenges that we see. But as I said, the access to healthcare component is a very different experience to other migrants. However, as Eugen highlighted, this was not the experience for everyone fleeing Ukraine. And there's been quite a few documentation and examples of what were the different challenges for other groups that were fleeing Ukraine, including the Roma population that was living in Ukraine, that have experienced discrimination in the healthcare system. There has been a parallel service offered to them. Not all of them have been recognized through the temporary protection directive because they might not have the right documents. And so this is something that has been a challenge. And then we know that there's other third country nationals that were living in Ukraine, or people from other backgrounds living in Ukraine, that as well were not necessarily eligible for the temporary protection directive and therefore not eligible for healthcare. In some countries, those that were unable to go home have ended up in detention or ended up along irregular migration routes in Europe. So, and then falling into many of the difficulties that other irregular migrants in Europe and undocumented people in Europe face. So I think the Ukrainian example demonstrates many positive lessons learned, but in that also challenges, because it's always challenging. But also we know that there was still quite a different experiences and difficulties faced by minorities in that process as well. And that's something that we should always nuance when we're discussing the response.
But we have a lot of treaties, policies between countries. In your opinion, what are these policy gaps that we still have that will give the migratory populations access to services, as you mentioned and Eugen mentioned, in terms of the Roma particularly and other nationals coming from Ukraine? What do you think are still the gaps in policy?
So I think there's still a massive gap in policy in terms of countries' commitments to, as we mentioned before, universal healthcare and the specific inclusion of all people, regardless of their legal status, in terms of their access to healthcare. And the separation of healthcare with migratory policy is very important, and that we maintain that. So I think that that's something that we see that is still something that needs to be reinforced globally, and is a very important kind of commitment to be made. There have been some efforts, for example, with the Global Compact for refugees and migrants. There were some mentions of health in there, but I think that there was still significantly more to be made. But, I think that today, we also have to return to conventions that, for example, ensuring that countries properly apply the Geneva Convention and refugee law in their countries, and that countries are not making access to asylum and refugee status restrictive. But, not everyone is asylum seeker or refugee. And I think that also looking at potentially the migrant workers framework that's led by the ILO and the commitments there is also something that we know is not signed by many countries, and is something that should also be is something that's also important, because we know that oftentimes labor migration is the main migration in the world, and we know that the rights of labor migrants is not always protected, including the rights and access to healthcare. So, as we discussed on this topic, migration is not a singular topic. It's very heterogeneous. It's very complex, and there's different categories of migrants that have different needs. I'm sure many of us in this, me, you, or many people listening, have been migrants of different kinds at some points in our lives. But the problem is that and we're fine. But the problem is that there is a cohort of very vulnerable people that are migrating or are on the move, and oftentimes these are people that are forced to migrate for various reasons, whether it's that their countries are unsafe, or poverty, or increasingly climate change, and as we see, malnutrition with the global malnutrition crisis that we're facing. And oftentimes they're the ones that then end up the most excluded, along the most dangerous routes, the most exposed to restrictive migration policies, and then as a result have the most poor health outcomes related to their migration experience, which is only reinforcing that exclusion and that global inequity that we should be challenging.
Reem, we've been speaking a lot about the policy level and its influence on health. I'd like to shift direction and ask you for suggestions for improvements at the frontline level. What kind of health facility solutions and strategies can ensure dignified and quality care for refugees and migrants?
So I think actually the solutions for increasing quality care are actually not that complicated and have a lot to do with willingness. And so actually a lot of things have to do also with like cultural competencies and understanding that there is a need for culturally adapted care, which also requires access to different linguistics. So I think that's very key. And in our operations as MSF, we have found that having cultural mediation teams that aren't just about translation, but about improving our culturally competent care are key in any of our projects. So I think that that's always something to reinforce in the healthcare system and in our health workforces more generally. Then, I think it's also about many of the innovations that we've seen are being led by civil society or by really local health actors. And I think that that's very encouraging and very nice to see. And that has to be about how do you make your healthcare accessible to people. And so, we talked about the ways in which migrants are excluded. So it's about how do you bring healthcare services in closer proximity to those groups, looking at maybe mobile health services if needed, thinking about health promotion differently and digital forms of health promotion as well. And that was something that we had to explore during the COVID intervention in terms of working on digital forms of health promotion in various languages to interact with communities, particularly during the lockdowns, right? And so how can we continue to grow those things? And then also, how do you have a more kind of holistic service, knowing that for many migrants, the element of the social determinants of health are maybe more prominent than it could be for someone who is in their home society, right? They're often dealing with administrative barriers. They're dealing with maybe other social difficulties that contribute to their poor health outcomes. And so as organizations or as people that are maybe more focused on health, how do we have a more holistic health understanding? And maybe then how do we bring those services together? How do we work in a more complementary way with services? So we talk about having more holistic models of care or multidisciplinary models of care that include not just providing medical assistance, but also providing potentially sometimes legal assistance, social assistance, in a one service that enables people to really be able to address that multitude of needs, because we know that that sometimes that's the main key or contributor to poor health outcomes. And I think so it's important to think about also how do we be more multidisciplinary in our approach to healthcare.
Yeah, these are very valid points. And as you said, it's simple, but it's also hard to implement, and it's not done consistently in various settings.
And maybe I'll add one more, which I think is actually key: working with communities and working alongside them. And I think oftentimes that's something as well that we, it's maybe, as we said, it's, we think about innovation as technology, but actually taking a step back and thinking about what is the role of communities in their healthcare, and knowing that many of these, sometimes some of the patients that we work with are coming from countries that have a bigger component of community health than our systems in the West. And so how do we actually learn from them in bringing back a community health perspective and reinforcing that? And I think we also learned during the pandemic why community health is as important as individual health. And I think there's some ways of working and lessons learned that we could probably take from some of the migrant communities that we work with.
I really enjoyed talking to you today, and I can see the passion for this kind of work that you're doing. Before I let you go, maybe you can share with our listeners what gives you hope each day to continue to do the work that you do.
So I think what gives me hope is that the fact is that one is the tenacity of migrants themselves. And, oftentimes people who are migrating, people on the move, they're migrating them on the move because they have a hope. And they have a hope that they're going to reach a place that then they will be able to be safe, to take care of themselves, to often take care of their families, and to make a positive contribution to the place that they're going. And I think that hope, and actually that often dream that people have along these migration routes often is about then how can we make sure that people are as safe and well when they're trying to achieve that hope. So I think that's for me one of my personal drivers and something that gives me hope. And then to add to that is to see actually all the people that work tirelessly, both in different fields, whether they're doctors, whether they're nurses, whether they're drivers that are oftentimes helping and supporting migrants in very, very complicated circumstances around the world. And I think that there is people that not just from MSF, but oftentimes from civil societies, but also just from individuals themselves and from communities themselves that are oftentimes really supporting people along migration routes and supporting each other, migrants supporting each other on migration routes. And I think that that's a great human story. And I think we always think about it as something there's a lot of tragedy on a lot of migration routes, but that tragedy comes more from policies and structures, but actually oftentimes the support that humans are giving each other on these routes is one of my motivators. So it's a complex topic, but I think there is a lot of hope there as well.
Thanks for joining us today, Rim, and I wish you and MSF best of luck and continuing doing this important work.
Thank you so much. Thanks for having us.
From the perspectives shared by Rim and Eugen, there is no denying that migration is a highly complex issue. People who set out on these journeys do so with a vision to build a good life and safe life for themselves and their families, often at great risk. Ensuring the health of refugees and migrants is filled with many challenges, including restrictive policies that limit access to preventative and comprehensive health services. In dealing with such a complex multifactorial issue, it is easy to feel overwhelmed, and yet I believe each of us can play a role. Extending a helping hand free of discrimination and judgment can go a long way. I'll leave you with a quote by Jorge Ramos, a Mexican-American journalist who said, "The greatest nations are defined by how they treat their most vulnerable inhabitants."
Hello, this is Adriana Corluca from Canada. I'd like to express my appreciation to TDR and the podcast host Gary Aslanian for doing such a terrific job at presenting the wide array of topics in global health. I especially appreciate the variety of guests and speakers that have been invited to the podcast and to hear the full spectrum of the different players in global health, influences, stakeholders, leaders. Thank you.
Thank you, Adriana, for your kind words, and thank you for all our listeners for your support. We want to remind you that on our webpage, you can find more information about each episode, including suggested readings by our guests, show notes, and translations. Get in touch with us on social media, via email, or by sharing a voice message with us. Tune in again next month as we tackle yet another critical issue in global health.
Global Health Matters is produced by TDR, an infectious diseases research program based at the World Health Organization. Gary Aslanian, Lindy Van Niekerk, and Maki Kitamura are the content producers, and Obadiah George is the technical producer. This podcast was also made possible with the support of Chris Coase, Elisabetta Dessy, Isa Suderdayao, Noreen O'Gallagher, and Chembe Collaborative. The goal of Global Health Matters is to produce a forum for sharing perspectives on key issues affecting global health research. Send us your comments and suggestions by email or voice message to tdrpod@who.int, and be sure to download and subscribe wherever you get your podcasts. Thank you for listening.